I'm really delighted to welcome everybody in the room and also those joining online to day one of the UK Cystic Fibrosis Conference. It's fantastic that we're all together celebrating the various inputs that the CF Trust have into all aspects of contributing to a life unlimited for people with cystic fibrosis. So I'm just going to do a slight introductory talk before we hear from Professor Gray. So I am a clinical associate professor at the UCL Great Ormond Street Institute of Child Health and a consultant paediatrician at Great Ormond Street Hospital. And these are my disclosures. And what I want to do is really just frame the conference and how this is going to run over today and tomorrow. And this is the first time that as a UK CF conference we're looking at the whole umbrella of what the Cystic Fibrosis Trust contribute to in terms of the ecosystem that exists to support people with cystic fibrosis, the research aims and the living longer and healthier lives with cystic fibrosis. So we're going to talk about the Cystic Fibrosis Registry, the Clinical Trials Accelerator, or more CTAP, and the Research Awards and Partnership. And these three arms have very much been brought together as a one throughout this conference. And to start with, I wanted to take this opportunity to share some hot off the press data from the 2024 UK Cystic Fibrosis Registry. So you may have seen the hard copies of the at a glance report, which has been published just in time for this conference, but I'm going to show some of the infographics from that report now. So you can see in 2024, we had over 10,000 people with an annual review recorded, and we can see that there were 164 new diagnoses in 2024, people with cystic fibrosis. And although the majority of those people are diagnosed through newborn screening, it is important to see that there are still a proportion of people diagnosed in later childhood and in adulthood, and that is important for us not to forget. It was exciting to see that 111 women with CF had babies in 2024 and 35 men with CF became fathers for the first time in 2024. And then what we like doing is having a look back, particularly as this is a real time of change in cystic fibrosis, to see how clinical outcomes are meaningful to people with cystic fibrosis, but as well as something that we really depend on in clinic to look at how people are getting on in terms of their lung health and overall health. So here we can see lung function, so their median FEV1% predicted at annual review at the different age bands, 10, 20, 30 and 40-year-olds, and see how that has changed between 2019 and 2024. A lot has happened between 2019 and 2024, not least the contribution of CFTR modulators to the population. And now all of these age groups have the majority of people eligible for CFTR modulators. But we can see really excellent lung function, particularly in the children and the younger adults now. But there's still some room to go in terms of the improving lung function and preserving lung function in people living with CF as they enter their older years. We can also see some marked changes over the past 5 years in the use of intravenous antibiotics. So in 2019, 44.5% of people with cystic fibrosis had at least one course of IV antibiotics at home or in hospital. But by 2024, only 1 in 5 did. And that's quite a dramatic change over those few years. We've obviously had things like COVID really impacting on admissions in those interim years, but now we have a bigger gap and a more kind of clear impression of what is happening with admissions for IV antibiotics. So these are really drastic changes that we've seen in this registry data. This is hopefully not too small for you to see, but just to project this slide summarises the lung infections and respiratory cultures, again showing that comparison between 2019 and 2024. So the blue columns here are 2019, the yellow are 2024, and you can see for all of these infections, but particularly for chronic Pseudomonas and particularly for chronic Staph aureus, the proportion of people with these positive samples has really decreased substantially over that time. And increasingly, as we see the clinical outcomes improving in terms of people living longer and people's lung function improving over time, it's really important that we don't forget those comorbidities, other complications that occur very commonly, as we know, in people with cystic fibrosis. So to start with cystic fibrosis diabetes, on the left here, we see in children, so aged 10 to 15 years, the proportion of people on some treatment for CF diabetes going down from 13.1% in 2019 to 9.2% in 2024. And for adults aged 16 and above, very similar proportion of people on treatment for cystic fibrosis diabetes across these 2 time periods. When we look at liver and gastrointestinal complications, we can actually see an increase between 2019 in those having recorded on the Cystic Fibrosis Registry liver disease or raised liver enzymes, according to the impression of the clinical centre entering those data on the registry. And then when we look at CFTR modulated use, obviously this is something that has really changed over the last few years. And here we have a snapshot of the cystic fibrosis population in the UK and the modulator use in 2024. So we can see that 80% of people had a record on the registry of using elexacaftor, tezacaftor, ivacaftor or Kaftrio in 2024. And we can see there the other modulators in dark blue and yellow and black there. And we can see there also we have 2 other important groups. So we have a sort of brownie colour group which are not on a CFTR modulator in 2024, but these people are people who have previously had record of a prescription of a modulator on the registry. So these people may be people that have had a temporary or a permanent interruption in that treatment, but not recorded as being on it at the time that the data were there in 2024. And then we have 12.4% of people who have never used a CFTR modulator. So this incorporates people who may not be eligible for a CFTR modulator on the basis of their CF genotype or their age. And then I wanted to move on to talk about Clinical Trials Accelerator Platform, or CTAP. And this is a really sort of pivotal network that the Cystic Fibrosis Trust and the Cystic Fibrosis Foundation contribute to the delivery and success of clinical trials in CF in the UK. So this is part of a really successful global partnership and trials network incorporating the European Cystic Fibrosis Society Clinical Trials Network and the US Cystic Fibrosis Foundation Therapeutics Development Network. And this creates really a really robust infrastructure to support the delivery of clinical trials in the UK. The majority of UK CF centres are part of CTAP or have a referral pathway in place to enable their patients to participate in trials being run through those centres. And CTAP links sponsors with the registry to support feasibility and identification of centres and trial participants across the UK. And CTAP isn't just about the network of centres, but also really key that engagement with industry and the contribution of the CF community, people with cystic fibrosis, really helping to drive the design of clinical trials, contribute their impressions as to what might be reasonable or not to expect in a clinical trial protocol, and shape the delivery and shape of these clinical trials. In terms of CTAP centres, as I said, there were 25 of them. So these 25 centres include both paediatric and adult centres, each with highly experienced principal investigators, and they cover around 90% of the UK cystic fibrosis population. They also have a network of 25 CTAP trial coordinators to support the study setup and delivery. And I know many of you are in the room, and the support of the CTAP coordinators have been instrumental in the success of the CTAP network. And then moving to the research awards and partnerships. So the contribution of the Cystic Fibrosis Trust to the research infrastructure in cystic fibrosis in general is really quite phenomenal. So on this slide here, we have that's just moved. On this slide here, we have the outputs since 2013. So funding over 250 principal investigators at over 100 organisations and institutions in 17 countries and 4 continents. Over 200 early career researchers have been funded through the Trust's research award funding schemes and invest in 22 million on strategic research centre and development awards. And the combined spend from the Trust and its partners is 58 million through our partnership funding schemes. So I think you can really see the punch that really delivers in terms of the contribution to research in cystic fibrosis, not just on a UK, but on a global scale. And that brings me nicely to the goals, the research goals of the Cystic Fibrosis Trust, and this is really how the conference is framed over the next couple of days. So there's 4 research goals as listed on the slide here: to develop effective treatments for all, to improve the diagnosis and treatment for CF lung infections and maintain lung health, to treat all of the symptoms of CF throughout the body, and to enable people with CF to live longer, healthier lives. So we're going to concentrate on 2 of these goals today and 2 tomorrow. And if you want to have more information about the research goals of the CF Trust, you can scan this code here for a PDF. But to introduce the 2 goals that we're going to cover today, I want to show 2 short videos from the CF community. So this first video is addresses the goal to enable people with CF to live longer, healthier lives.
I'm keen for the CF sort of passport that they're talking about, that you can use and give to other doctors that are not mainstream CF. And I think it will make a big difference because we are living longer because of the changes and the improvements. But it's no good if your quality of life is not good. Like we've added in asthma nurses and things like that, we need to be getting the geriatricians involved now, so that as and when we get that much older, we have these people who already know what the normal life of somebody with CF is and what the other complications are. I've always gone to the dental hospital. So at the very front of your file, they have on there what your medication is. Anywhere else, it doesn't. Whether it be your main hospital, another hospital, physio department, whatever, they never have your medications to hand. They always ask you, well, what are you taking? When do you take it? How much do you take? Etc, etc, etc. If I become affected by dementia or Alzheimer's and we don't know about it, what's going to happen when I don't tell you I'm taking something because I've forgotten? How are you going to know that I've started to forget things like that, and you're going to have that information readily to hand?
And then we're now going to watch a short video on the second goal that we're going to cover today. So this is to treat all of the symptoms of CF throughout the body.
The GI symptoms that I experience with cystic fibrosis ranges day to day, but it's always something that appears really unexpectedly and causes me a lot of pain and a lot of discomfort, and often means that I have to change my plans really last minute and always calculate how I can start to alleviate the pain. For a lot of us, especially those of us on Kaftrio and these modulators, that not every aspect of CF has been magically cured, and yes, I can breathe significantly better than I used to be able to, but at the same time my tummy is always sore and it's always really debilitating, and it can cause a lot of discomfort and a lot of stress and a lot of anxiety.
CF-related diabetes impacts my life in many ways, both kind of mentally and logistically in the day. Mentally, it can cause a bit of an unhealthy obsession with what I'm eating, because I'm constantly having to count carbohydrates, watch, the foods that I ingest and whether they're gonna make my sugars go too high or whether they're gonna cause my sugars to potentially go too low. This can lead to highlighting kind of the idea and the notion that some foods are good and some foods are bad, and that, in my case, has led to disordered eating. Logistically, during the day, it affects me by, I can't just sit down and have a meal. I would like other people to know just how turbulent having CF-related diabetes is and how it can be affected by so many different things that are out of my control. For example, it can be affected by the exacerbations I have in my cystic fibrosis and about whether I'm feeling healthy or whether I'm feeling under the weather with a chest infection. It can also be affected by stress in my daily life, and it can be affected by hormones, and actually my sugars seem to be more uncontrollable at different points in my menstrual cycle.
My gut issues have continued, and if not worse, since starting Kaftrio, and it would be really, really great if we could have a drug that reduces these symptoms on the day-to-day.
My one wish for the research on CF-related diabetes would be that there is a focus on the variability in this type of diabetes. I could probably eat the same thing 2 days in a row, but one day my sugars may cope fine with it, and one day they may go too high or too low, even with the exact same amounts of insulin at the exact same times in both of those days.